Hello, hello, my friends. It is Jill from the IC Network. Here, hold on one sec. It's always an adventure setting up a stream. All right. Okay. Let's see if that works. Hello, hello, my friends. It's Jill Osborne from the Interstitial Cystitis Network. It is Sunday, July 20th of 2025. Normally on Sundays, we'd like to do a drop-in IC support group meeting, see if there's anybody out there who's struggling, who needs a little bit of help. Hello, Anne. Anne, what a great question. I will get to that in a minute. Anyway, thank you, honey. Thank you. My purpose in doing these meetings is to make you strong, knowledgeable, and informed. I want you to walk with confidence with your head held high. You have done nothing wrong. This is not your fault. And that is indeed what we are going to talk a little bit about today. But this is for patients and family members who have interstitial cystitis, bladder pain syndrome, pelvic pain syndrome, vulvodynia, IBS, TMJ. If you got it, you got it. This is a home for you. And I want you to consider me your IC friend. Hello, Boria. Long time no see, girl. How are you doing? You doing okay? Anne, how are you doing today? You guys feeling good? All right. You want your hair braided? Listen, this is pretty much the only braid that I can do. I mean, I kind of suck at French braids. I almost was starting to think I wanted to dye it. I started filming. I filmed a bunch of videos, and I could see that from here to here, it was a lot lighter than down here, and that's because there's a lot more, dare I say, white hair. And you know, the challenge here is that that's just kind of the period of stress I've been through. So anyway, if we come back in a couple of weeks and my hair's shorter and it's all red again, don't be surprised. Although granted, I don't like the way red dye looks, to be quite honest. So normally when I do these meetings, I do a little intro, and then we'll take your questions and as long as I can. Boria so we're live streaming right now. So when I'm looking here, I'm looking at Facebook. When I'm looking over here, I am looking at YouTube. Boria, girl has an infection. You got a bladder infection? Do you know what it is? There have been some weird infections going around this year. Very, very strange, unusual, very drug-resistant infections that have been hitting IC patients. It's quite baffling. I mean, we have had some patients call who have had their next generation DNA urine test, and you know, guys, I did my senior project when I got my degree on the isolation of drug-resistant bacteria, and I like to think that I'm very informed about bacterial infections. Damn, there are some new infections. In one case, I was working with a patient who last week who had an infection that's known to be fatal. And it's like, how did you get exposed to that? And in her case, it was a nosocomial infection. So what that means, nosocomial means that you've gotten it in a healthcare setting. So she had gotten injured in some way. I don't remember what the injury was, but she had to go to the hospital. And clearly she got it at the hospital. And whoo, man, we were looking it up together because her doctors weren't explaining it to her well. A lot of people call me just to try to interpret what their doctors are saying. And whew, I don't think I've really ever seen an infection known to be fatal ever in IC patients before. she was responding to treatment, thank God. But yikes. Judy says, my therapist told me to use the wand. It's sore and it feels like my muscles are tighter. Okay, that's normal. You got to remember, okay, a healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like a cooked or rubber chicken breast. You know those chicken breasts where you can like literally peel the sections off? It's so tough. That's what a tight muscle feels like. A damaged muscle feels like beef jerky. It's just come stiff. And so as you are using your wand internally, as you're trying to kind of learn your anatomy, there's a big learning curve. When I do mine, I'm looking for tenderness. I'm looking for pain, discomfort. And inevitably the muscle where that is stiffer and it's lifted a little bit. Here, hold on a sec. I'm so weird when I talk a lot, as I am known to do. My tonsils jab me. So Judy, I have a video over in our IC101 masterclass about pelvic floor work. You should go watch that. It's like something is on my tonsil. Boria has her 5th infection. Boria, lactoferrin might be a good choice for you because lactoferrin boosts the immune system. So we have research now that not only shows that it dramatically helps sight see and makes red inflamed bladders pink and healthy, but 2 years earlier, that same research team did a study that showed that lactoferrin was very good at preventing recurring UTI. So if you've had 5 infections recently, then that tells us that either you might have a very drug-resistant infection, maybe you're in estrogen atrophy and your skin just can't defend itself from infection, or maybe there's an immune system dysfunction, like common variable immune deficiency, that sometimes makes you more vulnerable to UTI. Okay, guys, I need to go to Anne first. Okay, so, and I still have something I want to talk about. Anne says, what can I do for anal itching? She says her tushy itches every night. And this is a safe place. We can talk about anything here. And as a matter of fact, our new 2025 Guide to Managing Flares actually has a section on anal discomfort. Right here, my friends. So let's go over this for a moment. There is nothing more frustrating than a throbbing, painful anus and rectum. But for the IC patient, the first suspect is typically a simple hemorrhoid. Those swollen, inflamed veins emerge around and inside the anus while straining to have a bowel movement, or for young mothers if you're straining to have a child during childbirth. And given the fact that many ICers struggle with constipation and have been known to strain to push urine out, hemorrhoids can easily occur. Push too hard, and you could even develop a tear in the tissue known as an anal fissure. If you feel pressure inside of your anus, this means that you could have some swelling internally or perhaps be very constipated with hardened poop stuck within. We call this packing. Listen, you got to understand. I had terrible bowel issues in my 20s. I had IBS, and I was so embarrassed to talk about it. It's like, oh my God, this is just awful. I'm 65 now. It's okay. And the lesson I learned from my primary care provider quite some time ago, who was a young hottie doctor, and I was very reluctant to explain how my rectum hurt. He said, Jill, I have ulcerative colitis. If there's anybody you can talk to about a sore rectum, it's me. So it's okay to talk about rectal things. Okay. If you're passing hard marble-like poops, that's a sign of dehydration and chronic constipation. While I spent many years assuming that my occasional bouts of pain were due to hemorrhoids, I've now found that this is actually one of the first signs my pelvic floor muscles are getting tight again. When I touch the muscles an inch or two to the left or right of my rectum, they are always sensitive and more painful. A sudden spasm of the levator ana muscles can literally stop you in your tracks for a few minutes. This is called proctalgia fugax. And yes, I had several of these attacks when I was younger and struggling with IBS. Today, when pain occurs, I simply use my wand vaginally to relax the muscles. It usually resolves quickly, but that's me. That might not be the cause of your pain. All right. So what causes this rectal pain and discomfort? What Ann just says here, they told you have a tight anal sphincter, which inevitably probably also suggests that you have a tight pelvic floor. Ann says here also she has problems with psyllium husk. So do I. We do better not with psyllium husk, but with a acacia fiber, a soluble acacia fiber. And hold on, let me see if I do. Heather's tummy fiber is my favorite fiber. You can get it on their website, helpforibs.com. I don't have any in my store right now because this fiber, this organic fiber, comes from Senegal, and there's a war. And they cannot get the inspectors in to prove that it's organic. And so the supply of acacia fiber is very, very small. They just got a very small shipment up at Heather's factory. So you can go to her website and buy it. I just can't get it from her yet. But this is what I use. I literally have this in my kitchen right now. It might be helping, but the problem with psyllium is it's half soluble and half insoluble. And if you're sensitive to insoluble fiber, it's going to be a little bit more irritating. Soluble fiber is better. With respect, Ann's asking for a cream. I use Preparation H wipes. Preparation H wipes come in a bright yellow packet. Love, love, love them. You could ask your doctor for Proctofoam. Proctofoam, this wonderful pain-reducing foam that you kind of inject. It's just you just put it right inside your rectum. They can give you a triamcinolone suppository. I've used those too. And you could get Preparation H cream. You could get Tux medicated pads with witch hazel. Those are absolutely wonderful too. Jolene said, okay, so anyway, I've got a whole rescue plan here on what you can do for a rectal flare. So if you're a member, go look at your spring magazine. If you're not a member, think about becoming a member because you can then get this. I think this is the best one we've ever done. This is our 23rd year. So I've now had doctors, including one of the top IC doctors, looked at it and he went, Jill, this is fabulous. We're back, baby. All right. Jolene says, do you know of any caffeine-free, acid-free teas that actually taste like tea that I can use for iced tea? Celestial Seasonings quit making the one I used. I have a lot of flavored caffeine-free, acid-free tea that tastes like Earl Grey, something like that. I don't. I mean, the best I've got is Dandy Blend Herbal Coffee, which is perfectly bladder friendly. If you go over to icdietproject.com, we have a lot of recipes over there for summer teas that you can make sun teas, herbal teas, things like that. So you might find that to be helpful. I don't have a brand though. Boria, are you getting antibiotics for your infection? Are you being actively treated? Crystal says, hello. Hello, Crystal. Nice to meet you. I'm Jill. Hello, Diane. Nice to see you. Crystal says, I have IC, pelvic pain, pelvic floor dysfunctions, IBS, and other chronic health conditions and chronic pain conditions besides these. Girl, welcome. So do I. But you know what? Mine are completely controlled. And the reason why they're controlled is because I finally received a proper phenotyping. So in my case, I'm just like you. I had terrible bladder pain. I had pelvic floor dysfunction, but I also had the widespread pain, the IBS, the vulvodynia, characterized by very sensitive skin, a wicked sense of smell. So in our phenotyping, I am pelvic floor driven, widespread pain driven. What does that mean? Well, number one, I have a healthy bladder. Even though I was peeing every 15 minutes at my worst, whenever they looked in my bladder was fine. My pelvic floor was like concrete. It was so hard. And that's because all of my very, very first urinary symptoms began when I was in 7th grade and I fell and broke my tailbone. I had very, very tight muscles from that old break. Of course, we didn't know that back then. They just assumed that I had infection and they gave me lots and lots of antibiotics that never worked. But the one thing the doctor said is, wow, your urethra is really narrow. We better pry it open. We call that a urethral dilation. And I had many of those done as a kid. But nobody ever said, gee, why would her urethra be narrow in the first place? It's like trying to pee through a needle. Hello, tight pelvic floor muscles. And it took us 30 years to figure that out. So once I got my proper pelvic floor physical therapy, things got massively better, massively better. But in the same sense, the other thing we really have to understand is this whole widespread pain thing, because that's actually driven by the central nervous system. That is a distinct phenotype of IC. And for patients who have widespread pain, therapeutically, we have to calm the central nervous system down. That is our focus. Patients who have widespread pain, what the research shows is that their brain is behaving as if their life is at stake every moment of every day. They are in constant fight or flight. And the problem is when you're in fight or flight, the pain gets amplified throughout the entire body. Fight or flight is normally short term. It's not meant to be long term. When it's stuck in the on position, it changes our nervous system for the worse. And your body becomes very, very hypervigilant. And then anxiety builds, and then pain builds, all sorts of other things. Not mental illness. Nobody is saying this is mental illness. This is, in fact, injury. This is injury to the central nervous system that is normally a physical injury. In 80% of the children who grow up to have widespread pain, there is a massive physical injury in childhood. And for the other 20%, it's often a history of abuse. And in both of those circumstances, that pushes the brain into constant fight or flight. And before you know it, you've been in fight or flight for 20 years, 25 years, 30 years. And then all of these other pain conditions slowly begin to emerge. That's what happened to me. But all of those conditions are now completely controlled. I do not live with pain every day anymore, and I haven't for quite some time. Loretta here says, on the tea topic, I can get away with cold brewed tea, which diminishes the acid. Sun brewed does not. Your body will let you know if you can tolerate it. That's a good idea. All right. So Crystal is saying, well, here, hold on a sec. Man, okay, you guys, bear with me. Everybody ask questions. Be the squeaky wheel. Keep asking your question until I answer it. Okay. And clobetasol is a steroid. It's a strong steroid often used down there. And says, can vaginal atrophy cause anal itching? Absolutely. Will estrogen help? Yes, estrogen will improve the health of your skin. Judy says, do I think a vibration wand is better for tight muscles? It might be. It might be. Okay, let's come back over here to YouTube. Okay, hold on. I got to have the right mouse. Okay, hold on. Yeah, Crystal, we have on the IC Network website a free video series called the IC 101 Masterclass. I would really encourage you to watch it. So you're newly diagnosed and they're already considering Interstim? That's weird. Interstim is not a first line treatment for IC at all. Um, Today, the single most important test you need to have is a pelvic floor physical therapy, a pelvic floor exam. If they find tight pelvic floor muscles, the number one recommended treatment for IC is pelvic floor physical therapy. So, have they sent you to physical therapy yet? Um, okay. Now, the blessing here. Hi, Donna. Oh, honey. Hello, Donna. And if your mom's there, hi, mom. Um, so, Crystal, you are absolutely at one of the best IC centers in the world. If you're up at Royal Oak, Beaumont, Corewell Health, if you're under the care of Dr. Ken Peters in his clinic, they literally, at this point in time, are number one or number two in the world. They're definitely the best IC research team in the world. Okay. So if I could have had a chance to see Dr. Peters, believe me, I really wish I could have, but I am across the country. So you can trust what they're telling you. In fact, I just had an email from Dr. Peters. On the other hand, you also have to be an equal participant in this discussion. And it's very, very important that you not give your power away, that you walk into that appointment understanding as much as you can about IC, as much as you can about pelvic pain, as much as you can about tight muscles, and as much as you can about neuromodulation. Because Interstim is a surgery. And it's not just one surgery, it could lead to multiple surgery. So they have to do a trial, 2-week trial. If your symptoms don't get better, then they abandon it. If your symptoms do improve, they would then implant a generator. And that generator is a little box in your upper butt area that will be a source of steady confusion. But I want you to ask more first about your anatomy. What is the health of your muscles? What is the health of your bladder wall? What is the health of your nervous system? And then based upon that, then we need to know what is the best treatment for your unique case. And generally, we start with the non-invasive, non-surgical things first, because once you open that door to surgery, then you're in a whole nother area. And again, listen, I have total respect for Ken Peters and his team. There's no one better in the world at doing that surgery, in my opinion. But I want you to be a little bit more, I'm not saying don't do it at all. That's not my place. But I want you to be able to engage in a really good discussion with him about the pros and cons a little bit more. Okay. And if you want to talk to me, I have a great section on Interstim on our website. It is very important. There's a couple of things you need to really understand about Interstim. Number one, it's hella expensive. So you need to absolutely make sure that it is covered by your insurance. And don't accept anybody's word for it. You need it in writing. So we had a patient who actually also was a nurse at a hospital who had IC. Her doctors, there were 3 doctors in her small town. They all said she needed Interstim. She didn't really want to do it, but she decided that they all said the same thing. She wanted to do it. But because she was a nurse and she understood the challenges of health insurance, she tried to be very, very diligent. So she talked to the billing person in the doctor's office, said, yes, it's covered, no written pre-authorization required. Then she called the hospital where she worked, where she was going to have it done, talked to the billing office. They all said, yes, absolutely covered. No written pre-authorization was required. Then she called the company, the health insurance company. They said, yes, it is absolutely covered. No written pre-authorization is required. So she had it done. A week later, they had denied it all, and she now had a bill for like $80,000, $90,000. And they threatened, her hospital threatened to garnish her wages. And she's like, you told me it was covered. Well, we're sorry, we made a mistake. 3 people, even her health insurance company, told her it was covered. It was on it. Hello, Mr. A. So you get it in writing first. The second question I want you to ask them is, if I lose my health insurance, will you continue to care for me? Because Interstim is not a one-off. Interstim requires constant monitoring. You're going to be going back to that doctor several times a year to get it checked. And then understand too that Interstim actually has a lot of potential adverse effects. Even at the best clinic in the world, there can be adverse effects. The most common adverse effect is a deep tissue infection at the site of the implant. But sometimes the device malfunctions, sometimes the device shocks you, sometimes the device moves. So this requires thought. And again, listen, you're lucky you're at that center, but I just want you to push back a little bit and learn a little bit more about your case and learn a little bit more about other options, especially physical therapy, things like that. Okay. Diane's saying, I'm thinking of getting a third opinion from Carl Creeder from the University of Iowa. Is the update on the latest? Not, never my place to say anything bad. He's a major IC researcher, a highly respected, but he did ask one of my clients why they wanted to be phenotyped, which doesn't make a lot of sense. But he's probably the best doctor in Iowa, and if you want an opinion, go for it. Again, you just got to walk in really knowledgeable, informed. Boria, I don't know why you're on DMSO. Diane says, for detection and treatment of Hunner's lesions, I've had one doctor say I didn't have lesions, the other one say I do. I did a urine test for Epstein-Barr, which came back negative. Don't know what to do. Well, maybe you need a third opinion. Did anybody take pictures of your bladder? The doctor who said you had Hunner's lesions. Guys, note to the wise, if you're ever having a cystoscopy or hydrodistension with cystoscopy, always ask them to take pictures so that you've got that in your hand so that you can show that to other doctors. Again, you could, while you're waiting for that, try some lactoferrin, because the IC lactoferrin study last year showed Hunner's lesions healed. So, might be worth a shot. Okay, Mr. A. I'm a 27-year-old male. I've been in remission for 6 months now. You got me through a really tough time, so thank you. Hey, excellent. That's what I love to hear. What helped you? Hello, RD. Nice to see you. Crystal, let's see. She's getting it for her overactive bladder. Okay. Crystal, did your pelvic floor respond to physical therapy, or did you always lock back down into tension? That's an important question. Hello, Cherry. I'm hoping that with the strict diet, they don't come back. Excellent. She says, I was diagnosed with IC last December, had a fulguration of lesions in December. Symptoms flared again this June. 6 months later, I had another lesion fulguration. You feel better. I'm hoping that with the strict diet, they don't come back. So, Sherry, we have new information on lesions. We now know that some lesions are caused by viral infection. Other lesions can be caused by a broken ligament that is pressing on nerves that cause the lesions to develop. So it'd be very interesting to know if you have any history of prolapse, because that would suggest that maybe you have a ligament issue. But it would also be very interesting to know if you have any history of Epstein-Barr. And again, you got to look at the lactoferrin. The lactoferrin IC study that came out last summer was just truly spectacular. That there were 31, this was an Italian study done at an Italian university. And you guys got to understand, European research is absolutely awesome. They go in directions that American researchers often don't go, which is lovely because we need more. We need lots of insight here. They had 31 patients in the study. They took lactoferrin for roughly about 5 months. What made this study incredibly powerful is that they did cystoscopies before and after lactoferrin, and they measured systemic inflammation with blood testing. And at the end of lactoferrin research, 28 out of 31 had no flares, no symptoms. Red inflamed bladders became pink and healthy, and Hunner's lesions almost completely disappeared, my friend. So here we have a very simple over-the-counter supplement, not artificially made in a lab, not associated with any great adverse events. There were no side effects in the IC study. That would be something that would be reasonable for you to try as a first line kind of self-help approach. And that's what our American Urology Association guidelines for IC encourage. They want you to try easy things before you get into the therapies that have more risk of adverse events. And so they encourage the use of over-the-counter supplements. They don't give any brand names, of course. They're very neutral about that. But it's all about minimizing risk. Good to know, Boria. Palm says, my rheumatologist told me to remove my bladder. She won't put me back on cyclosporin, even though my kidney doctor said it's okay. She told me to remove my bladder. My new rheumatologist wants to try IVG, but Mr. A said he got better with pelvic floor relaxation, amitriptyline, and no energy drinks. There you go. No energy. Listen, man, those energy drinks are pretty damn poisonous. Palm says she thinks her Sjogren's is playing a role in her symptoms. Sherry, we have it in the IC Network store. The ones that we recommend are the ones that come from Australia, the lactoferrin, because the cheap ones that come from China and America are coming from cows that have been exposed to bird flu. And we just don't think that that's smart. And so I get our lactoferrin from Australia. And that's where the researchers got theirs from too. RD says, I had bladder mesh complications. I have scarring on my bladder from a resection surgery. Could I technically have IC from the scarring? Well, you have pain, or you are a bladder pain patient or a pelvic pain patient. That could easily be the result of surgical trauma. That doesn't necessarily mean that there's any disease process happening. Our guidelines say they don't find disease in the vast majority of patients. The only patients who have a disease process going on are some Hunner lesion patients. For the rest of us, IC is usually neuromuscular. It is neuromuscular in 85% of patients. And so, yeah. The other great challenge, though, honey, it's the bladder mesh. The mesh is just horrific with the complications that it can cause. And so we have to assume that you probably have a lot of neuroinflammation, you might have a lot of scarring, and is that going to impact the functioning of your bladder? Yeah, it could. All right, let's come back to Facebook. You guys on YouTube, hold tight. I got lots of questions. You guys are busy today. So hold on a sec. Let me come back here to Facebook now. Maria said, I had a hydrodistension 2 weeks ago. Horrible, horrible pain afterwards. Still pretty bad. They found inflammation in my bladder, slight. I feel like this hydro was a mistake. I'm scared this extra pain won't calm down. Okay, so Maria, anytime pain gets worse after a procedure like that and it's persisting for weeks and weeks, there's a very good chance that you might have picked up an infection while you had that done, a nosocomial infection. It's very important that you call your doctor and ask them to do a urine test to make sure you didn't pick up an infection after that hydrodistension. As I would expect, after 2 weeks, things would have calmed down. I mean, hopefully they did what we call a low pressure, short duration hydrodistension, which minimizes damage. If they did a high pressure hydrodistension, that causes more damage. The good news here is that your bladder looked good. So now we can walk away from this. Your bladder is only slightly irritated. There's no Hunner's lesions, nothing like that. That's great information. Now we have to figure out, why is your bladder inflamed and what is driving these symptoms? So your bladder could be inflamed from your diet. Your bladder could be inflamed from a chemical exposure. Your bladder could be inflamed from, I'm sure they've already ruled out infection. But most importantly, your bladder can become very, very inflamed if you have very, very tight pelvic floor muscle. And somebody asks, why, if I have a pelvic floor flare, do I have bladder symptoms? It's really easy. When your muscles are tight, they squeeze nerves and blood supply to the bladder. And then the bladder wall starts to struggle. We call that ischemia. So when they did a study last year, they were trying to correlate, where did all this extreme frequency urgency come from? And so they were testing the ability of the bladder wall to cause these symptoms, and they were testing the ability of the muscles to cause these symptoms. And it turned out the pelvic floor muscles, when they're messed up, are notorious for causing urinary symptoms. And so too is a broken ligament, posterior fornix syndrome. That also can cause urinary symptoms that make you feel like you have an infection, even if you don't have an infection. Caddy says, what should I expect after a cystoscopy with fulguration coming up on Thursday? Caddy, you know, they're going to treat Hunner's lesions. That's good, because when you treat Hunner's lesions, the pain improves dramatically. So the goal here is to close that wound up. They're going to do that with fulguration. Excellent, excellent. You know, you will be recovering from a hydrodistension, and so that is a traumatic procedure to your urethra. So maybe a little traumatic to your bladder. It's normal to have some post-op discomfort for, I mean, some people go out to dinner afterwards. Other people might be in bed for several days. We won't know until you go through it. Make sure you ask the doctor to do what we call a low pressure procedure that minimizes pain and trauma as compared to a high pressure. And that's in the AUA guidelines for IC. So it's good that you're getting them treated, but you also have to understand that if you have lesions, diet has to be followed, because you have the equivalent of an open wound on your bladder. And if you pour acid in a wound every day, what's going to happen to that wound? Going to get worse. So your job is to create an environment that will support this tissue healing. And that means you stop pouring a massive amount of acid, alcohol, or salt, or caffeine on an injured bladder. I mean, the caffeine goes to your nervous system. It doesn't really go to your bladder wall, but it amps everything up. Nia says she doesn't have a diagnosis and she's losing hope. Well, Nia, you should call me, honey. We can try to phenotype you and then give you a new set of questions to ask your doc. That's what I do every day. It's free. Like, why not? Got nothing to lose, or at least go watch our IC 101 masterclass. That'll get you. You got to understand these phenotypes now, these distinct patient groups. I mean, listen, guys, you got to understand. We don't think of IC as an incurable bladder disease anymore. We don't. We think of IC as a pelvic pain syndrome for which there are many potential causes. And if you could actually go to a physical support group meeting, one of the things that you're going to see really, really quickly is how diverse we are. That for some people, IC begins in childhood. For others, it begins after menopause. For some, IC begins while they're going through chemotherapy because the chemicals of the chemo damage the bladder. While for others, IC begins while they fall on the tailbone. The other thing we very clearly know is bladder treatments don't work for the vast majority of patients. Why? Well, now we know why. There are distinct patient groups. So a one treatment fits all approach does not work in the IC world. Today, we phenotype. We try to figure out what group you're in because each group has their own treatment. So Hunner's lesions are a distinct group. Estrogen atrophy is a distinct group. Chemical injury is a distinct group. Our biggest group is pelvic floor. That's 85% of patients. We also have pudendal neuralgia patients where there's a localized nerve injury. They have pain when you sit down. It gets better when you stand up. And last but not least, we've got the widespread pain group where patients have a lot of different pain conditions, the IC, the IBS, the vulvodynia, the TMJ, fibromyalgia, migraines, etc. That is a central nervous system injury. So we need to figure out what group you're in. Kimberly says, I'm fairly new to IC. I was diagnosed after a hysterectomy. I have been in pelvic floor PT for about a year now, and although my discomfort and pain is much less, I still feel like my pelvic floor muscles get tight so easily. I've also been using the wand for about 8 months on a daily basis. Anything else I should try? Kimberly, I am in the exact same situation as you. I mean, the challenge is once you have a pelvic floor injury, it becomes, and we can work on those muscles and get those muscles to relax and release. The problem is that they're easily injured again. And it's going to be predictable if you have a physical problem that stresses those muscles, like a bad hip or a bad SI joint or a bad knee or a bad foot. How you walk affects your pelvic floor. So for my case, my muscles on my left side always stay tight because I have a bad SI joint on my left side. The muscles get tight to stabilize it. My joint is hypermobile. So the question you want to ask your physical therapist is, are my muscles responding to therapy or are they always locking back down into tension? If your muscles are always locking back down into tension, we got to figure out why, because that's when we look past the muscles at the bones. Because at the bones, it puts stress on the muscle. So again, a funky hip, a funky SI joint, a broken tailbone, a bad knee, a bad foot could be one reason why your muscles always lock down into tension. Judy says, my physical therapist told me to massage the area between my vagina and the rectum, also known as the perineum. That helped. Absolutely. It's hard though. Here, hold on. Let me get mine. Oh. Let's see here. Okay. Let me. Hello. Let us do a little wee anatomy lesson, shall we? This is the front of your pelvis. We have the pubic bone, the pubic symphysis. It's actually two bones that are connected by cartilage. And if we turn it around, now we've got our spinal cord, we've got our sacrum, we've got our hip. The SI joint is right here. It's the connection between the sacrum and the hip. That's where my issue is. We got the tailbone. And I want you to look at this tailbone, because when you think tailbone, you think, oh man, it's just hanging there. It's not doing a damn thing. Wrong. Your tailbone is your foundational center of your pelvis. You have muscles that go from one side and muscles that go to the other side. Okay, so here we have the structure, the cup of your pelvic floor. And when we look at it from this point, we look at it from the top down, these muscles are normally flat. They normally sit along the base and the sides of your pelvic cavity because they're basically holding structures in place. You know what? I can take my earbuds out. I do not need to have earbuds in right now. Okay. When these muscles get tight, one of the things that happens is they lift. They lift off the bone. And when they lift off of the bone, they start interfering with other things. Okay. And if we look at it from the bottom, here we have, so if you're sitting on a bike seat, you got to understand there's no bone there protecting this muscle. You are sitting directly on your pelvic floor and on muscles and nerves and blood vessels. Bike rider syndrome is real. That's from a long-term pressure on this pelvic floor that is damaging tissue. The outermost layer of muscle is here. And yes, my model is broken on one side. It just broke again, like a couple days ago. These are the levator ani right here. So let's look at these. So here's your levator ani. This is in a woman. So what makes the pelvic floor very unique and different as a skeletal muscles are muscles that are designed to help you move your body. So these are active working muscles. But what makes the pelvic floor very unique is that they're also the only skeletal muscles in the human body that control major bodily functions. Why? Because they have 3 holes. They have a hole for the urethra, they have a hole for the vagina, and they have a hole for the rectum. And in a man, they just have 2 holes. But look, you can see around the rectum and around these tissues, look at this, we got muscle. And if this muscle is tight, what do? Oh, they squeeze everything, which is why constipation is a classic symptom of very tight pelvic floor muscles. Why pain with intimacy is a very common symptom of very tight pelvic floor muscles. And also, you can tell the health of your muscles right now by how you pee. Listen, if you can sit on the toilet and pee like a horse, you are good. But if you're doing stopping and starting and your stream is narrow or narrow, your muscles aren't so good. I can tell you right now, my muscles right now are definitely tight. My muscles right now absolutely are tight. I can feel it. I need to use my wand. I tend to be a wee bit passive aggressive. I get so busy, I forget to do it. So here's your perineum right here. So they're absolutely right. Using your finger or using your wand and gently massaging in here, you can even do it a little bit through your vaginal wall or through your rectum, might be helpful. You know, it might be a little helpful. It's just, that's a big muscle group right there. All right. Nia says, it took me a year and 9 different urologists. Yep. Sheena says, I'm going through a flare right now, week and a half. Girl, I'm so sorry. I hope you have our new flare management guide. If you haven't seen it yet, here it is right here. The 2025 Guide to Managing IC Flares. We talk about the triggers, the rescue plans, and the treatments for flares. And we talk about bladder wall flares, pelvic floor flares, pudendal neuralgia flares, stress flares, menstrual flares, urethral flares, vulvodynia flares, rectal flares, sex flares, and allergy flares. You can find them right now. You can find it right now over on the IC Network website. It's in our shop. It's like $8 for a copy. And we already have some of the rescue plans on our website, and it's free. So just you can start on the, with the free stuff. But if that's not getting you anywhere, then we want to go to the more recent information. All right, let's come back here to YouTube. Oh, God, man, you guys are busy over here. Palm says they have gastroparesis. So do I. I have very mild gastroparesis. It sucks. Boria is seeing Dr. Jennifer Moldwin. She's fabulous, absolutely fabulous. She and her husband. Palm says, what are my thoughts on a heparin lidocaine installation? Absolutely the most popular bladder installation. It can help break you out of a flare. Not going to fix anything. But what it does over time is it slowly calms the nerves down. So rescue installation definitely a viable therapy for a bladder wall flare. But I would challenge you and say we need to make sure, number one, it's a bladder wall flare. And number two, if it is, we need to figure out what the hell's irritating your bladder in the first place. Could it be something simple like you having a cup of coffee every day? If you have estrogen atrophy, that would do it. So we want to try to identify the underlying cause and fix that too, so you're not suffering. Boria has some sort of stimulator in her back. It's not working. Sorry to hear that. Crystal said, pelvic floor physical therapy helped a little with the soft wave, but still peeing a lot, and you can't have sex without pain. So Crystal, again, go over to the IC Network and watch my video on physical therapy in the IC 101 video series, because that's going to give you some new questions to ask your doctor about it. And insurance only covered treatments, and the doctor wanted 12 done with pelvic physical therapy, but she said it would have helped more. The question that you ask your physical therapist after 6, 7 treatments or 4 or 5 treatments is, are my muscles responding or are they always locking back down into tension? If your muscles are always locking back down into tension, we need to figure out why. You need to ask her to study your body a little bit more to try to figure out what is putting that long-term persistent tension on those muscles. And again, hip, SI, tailbone, etc. Boria said she's doing DMSO. I don't understand why doctors are still doing DMSO. It's a very old treatment. But if it feels a little bit better, power to you. But I would want to know what your phenotype is, because DMSO is not going to fix a Hunner's lesion. DMSO is not going to fix estrogen atrophy. DMSO is not going to fix tight muscle. And DMSO is not going to fix widespread pain. So the only place for DMSO might be in the bladder wall-driven phenotype, but it's really purely for symptom relief. It's not going to fix anything. And again, we now really want to fix things. That's why we phenotype. I mean, my heart breaks for those millions and millions of people who have been told they have an incurable bladder disease when they don't have a disease at all. They either have tight pelvic floor muscles or estrogen atrophy or endometriosis or something like that. And a lot of patients just get so depressed. And that kind of brings me to what I want to talk about a little bit. So the title of our session today was, do your family believe you? I want to tell you the story of one of my earliest clients. She was fairly young, in her mid-20s, severe IC symptom. She constantly had blood in her urine, and she even had blood in her bowel on occasion. I mean, she was profoundly ill at the emergency room over and over and over. And remember, this was back before we were phenotyping. Her dad was a doctor, and her dad told her it was all in her head. And she got nothing from her family in the way of personal support. I'm not talking money, my friends. I'm just talking about having somebody to love on you and comfort you and hold you while you're bleeding. And they kicked her out of the house. And she ended up like living in a little hovel, bleeding constantly. And my heart broke for her that here we have a doctor who could see the blood and told her it was all in her head. Now, clearly in her case, there was something very, very severe going on. But we have to understand that 10 years ago, 15 years ago, 20 years ago, or older, or before that, many doctors were taught in medical school that IC wasn't real. And I can give you the history. You look at the earliest description of IC happened in the mid 1800s in England, and it's perfect. Frequency, urgency, pressure, pain with no obvious cause. Then in the early 1900s, they invented the cystoscope. They could look in the bladder. They saw problems with the bladder. Absolutely real. Then during World War II, we had research that shows that it could affect children, and we had research that showed it could affect men. And then in the 1950s, something very, very bad happened. Two arrogant pricks of a doctors published a case study of a young woman with IC in which they claimed she had unexpressed anger manifested in the pelvis. And that was a turning point because that became the moment where doctors went, oh, well, this must all be in your head. And medical schools taught from the 50s to the 90s that IC was in all likelihood a mental illness. And it wasn't until the US National Institutes of Health, as well as researchers around the world, convened and gave this credibility and started doing research with IC, technically in 1987. The problem is we have this very long legacy of decades where patients were minimized. Another one of my clients was up in Minnesota, and she had post-herpetic neuralgia. So she had been sexually abused by her father. He gave her herpes, horrific herpes. She was hospitalized and ended up with nerve damage. Okay, like I know her today. I've known her for 40 years. Catastrophic nerve damage in her pelvis. And at one point in time, somebody sent the police to where she was. They sent an ambulance to where she was. They strapped her down to a gurney, took her on a 3-hour ride to a mental hospital. And she is screaming, I need to use the bathroom. I need to use the bathroom. Please, please, please let me use the bathroom. And the longer they refused to let her use the restroom, the more agony she was in. Absolute horrific, horrific pain. I know her personally. And I've known her for many, many years. They finally get to the mental hospital. They unstrap her from the gurney, and she's just begging, please, please, would you please let me use the bathroom? And they just kind of looked her up and down and ignored her. Finally, they said, yes, but you have to let somebody go in with you. She did. She peed. 2 hours later, she got a personal apology from the head of the psych ward. Said, we are so sorry. You do not have a mental illness. You have a bladder disease. And they drove her home. That is still happening. That has still happened. And so I want you to know, I mean, granted, that's very, very extreme. But in our journey with IC, we have all encountered somebody who has said, maybe it's all in your head. I had a friend say to me, no longer a friend, I think you like being in pain. I was like, what? What are you talking about? I do not like this at all. This is awful. I haven't slept in a year. So the reason why I bring this up is that you and I have done nothing wrong. And you have to walk into every situation with confidence. This is not your fault. You have done nothing wrong. No shame, no blame at all. And one of the ways you build that confidence is with information and knowledge. The more you know about this, the better you can fight off with words anybody who has the audacity to suggest that this isn't real. And you know how it is. You go to the holidays, you go to a family dinner, and you dread it because number one, you don't know if you're going to be able to eat anything. And then there's going to inevitably be some distant family member or even a close family member who's going to say, "Man, you're not better yet. I had that. I cured myself drinking cranberry juice." And your answer is, "Man, I wish it was that easy." But actually, for me, because I have an injury in my pelvis, cranberry juice actually makes it a lot worse. And yes, I know you can't see it, but it's there and it's real. And here are my symptoms. I have not slept more than an hour in a year because I have nerve damage down there that makes me feel like I have to pee all the time. Or I have a muscle injury that gives me these symptoms. I have been listening recently to a bunch of stories on YouTube, little 30-minute vignettes of family members who've tried to take advantage of other family members, and they're entertaining. But you're always rooting for either the elder member in the family who's being used or the disabled person in your family who's just being minimized. And it really makes me think about how important it is that we not let anybody start to push us around um, with those subtle, demeaning comments of what, you're not doing your treatments? Why aren't you doing your treatments, Jill? Isn't there another medication they do? And your answer is going to be, well, this isn't really easily treated by medication because it's actually a problem with my SI joint and my tailbone. It takes physical therapy. Well, aren't you doing it? Well, I'd love to do it, but my insurance isn't covering that much. But I'm learning everything I can about that. Or if you're a Hunner's lesion patient saying, I have this thing you can't see. It's called a Hunner's lesion. It's actually an open wound on my bladder wall. And you know what the problem with the Hunner's lesion is? Is that when urine gets into it, it hurts like hell. And that's why I have to keep running to the bathroom, because anytime my bladder gets full, urine goes into the wound, and that hurts a lot. So we're trying to heal that lesion, but lesions are really hard to heal. They get irritated all the time. Or if you're a chemotherapy cystitis patient, it's like, I didn't want this to happen, but y'all remember when I had cancer 2 years ago and I went through chemotherapy? One of the problems with chemotherapy is that it erodes the tissue and you get a chemical burn. That happened to me. I have a chemical burn inside and I'm really trying to make it better, but it's a tough burn and it takes time. The hard part, the really, really hard part, are for patients who have a history of abuse, family abuse. Because if you're still near the abuser or you're living with a narcissistic parent or you're living with an alcoholic parent, they're not going to understand the role that they played in creating us. Because when you grow up in a very difficult home and you suffer abuse or adverse childhood events, your body responds to that. That is the equivalent of a central nervous system injury. And that can have a ripple effect throughout our lives. And so you also don't have to prove it to anybody. If you have a critic in your family who's just pushing away at you over and over again, walk away. They don't deserve an explanation. You don't owe them an explanation for anything. If somebody is genuinely supportive and they want to know a lot more about this, you can send them to our website. I will even talk to them on the phone. I do that all the time. If you have a family member who doesn't get it or a spouse who doesn't get it, call me. I'll be happy to talk to them. I will take any question they have. Believe me, anybody who's saying it's all in your head, you get them on the phone with me, I will get there. I will challenge them with facts and I will change their mind. I'm pretty good at that. So anyway, walk strong, walk tall, but remember it is your responsibility to educate yourself. They aren't going to do it, and they're never going to be able to say exactly what you need them to say because they have never been through this. This is why support is important. This is why having an IC buddy is important, because we know what it's like to flare. We know what it's like to live with that fear. We know what it's like to be up all night. We know what it's like to not feel happy because you're fighting pain all the time. And it's like you're fighting for your life and you're just trying to breathe. But again, we've come so far now. We've come so far. We have so much better information now than we did 10 years ago. You have every reason to carry hope in your heart. But it begins with phenotyping. We have to know what your phenotype is to find the right treatment. So, all right, let's go back to your question. Crystal says, I've tried many different medications, either bad side effects or didn't work, and I'm on a med now for the overactive bladder, and it helps some, but it's still peeing a lot. So Crystal, sometimes the reason why the nerves in the bladder get so irritated is because you have estrogen atrophy, and those nerves are more exposed because your bladder needs estrogen to make mucus. And it's the mucus that protects your bladder wall. But if you're on birth control, if you're on a Lupron for endo, if you're on estrogen suppression drugs for cancer, or if you're just getting older, you don't have the estrogen anymore, which means that nice thick mucosal layer that normally protects the nerves in your bladder is getting thinner and thinner, and their nerves are getting more exposed and more easily irritated. So the fix for that is to get the skin healthy again. And the way we get the skin healthy again is with topical estrogen. So again, cause versus effect. We don't just want to chase the symptoms. We want to try to identify underlying cause. Palm says, can you have two phenotypes? Yes, I'm widespread pain, pelvic floor myself. Gloria says, I'm getting Botox in September. I'm going to Italy for my son's wedding and I'm so nervous. You've got a bad hip. Okay. Well, Gloria, listen. If you catastrophize and assume the worst, you become a self-fulfilling prophecy. So how about doing some positive affirmations? I can do this. I love Italy. I'm going to go see my son get married. It's going to be a wonderful trip. My symptoms are going to be controlled. Change how you're thinking about it. Instead of worrying, start putting a lot of positivity in there, because Italy is a wonderful place to visit. And if you come prepared, so you're going to bring a muscle relaxant with you, you might bring some pain medicine with you, so that if the journey becomes a little bit more difficult, you'll know exactly what to do. You'll have what you need to do there. And hopefully the Botox is helpful. Crystal says, where do you find that for IC? Over on the IC Network website, icnetwork.org. R says, my surgeon keeps saying to me that he doesn't understand why I have pain. I just strongly let him know I have nerve pain. He was the one who caused the bladder mesh complications. Yeah. I'm not surprised. Palm says, a lot of doctors won't believe microgen or prognostics tests. They're just data. It's just data. Listen, infectious disease specialists believe next-gen testing. We are going to get to the point eventually where urologists start using it, because it is absolutely the best way to understand the biome is with next-gen testing. But right now, health insurance companies don't want to pay for it, and some doctors don't want to learn about it. Doesn't mean it's not valuable. It does give us data. And that's what we need, data, to try to understand what's driving your symptoms. Marcella, did you have a question? Susan said, as women, we need to take the same advice we would give our daughters on how to fight for ourselves. Every time I feel defeated, I think how I want my daughter to feel valued. Exactly. Marcella says, I've been taking 250 milligrams of lactoferrin for 3 months and it helps with Hunner's pain. Do you know if it's okay to take the lactoferrin long term? Well, the IC study was basically like a 5-month study. And so what I would encourage you to do is do the 5 months and then reevaluate. You might be able to lower the dose. You could potentially stop and just see how your symptoms do. And then you start feeling a few symptoms again, you can go right back on the lactoferrin. You maybe at a very, very low dose. Lactoferrin comes from milk. Okay, so it's not a synthetic medication where we're going to worry about long-term consequences to lactoferrin. I am personally not aware of long-term risks, and I've looked at about 30, 35 studies, but I would encourage you to look at those studies too and see if you can find anything that might worry you. I haven't seen it myself. All right, let's come back to Facebook here. All right, wrong mouse. Lisa, thank you for the stars. You guys, if you find these meetings helpful, we really, really appreciate it. If you could come on over to our website, sign up for our free newsletter. You'll get a pop-up window to do that. You could become a member and get our magazine, The Icy Optimist. Again, this is our latest one, our new flare guide. Already working on the summer one. You can sign up for coaching sessions. You can make a donation if you want, but every little bit, I'm not asking for anything big. Just understand that times are challenging right now for everybody, and I know they are, and I respect that because they're time for us too. But if you can maybe buy something in the IC Network store, like our book IC 101 or one of the supplements, rather than going on Amazon, that would be great. So let's see. John said, I had a top doctor tell me in 2013 that it was all in my head. I had symptoms starting around 4 or 5. Yeah. Yeah, first urologist I saw who I ended up loving, he said, I want you to go to therapy. I got very mad at him and said, no, I'm not going to therapy. I am peeing all night long. I clearly have a bladder issue. He was right, though, because he looked at my history and he saw that I had widespread pain. And he wanted me to read the mindfulness books, which act to calm the nervous system down. I just didn't understand that back then. All right, hold on a sec. Facebook here. If you asked a question and I miss it, please ask it again. Don't take it personally. Perla says, okay, so Perla asked about why does pelvic floor pain pelvic floor pain trigger bladder pain? That's from ischemia and that squeezing. Heidi says, I'm so thankful that my urogynecologist allows me to do at-home bladder instills 2 to 3 times a week. I use a mixture of heparin, lidocaine, and sodium bicarb. My insurance doesn't cover most of the costs, unfortunately, but I don't know how I'd get by without this. This might work for others. Yeah, honey, listen, Heidi, and I'm a Heidi too, by the way. It's always nice to meet another Heidi. Heidi is my middle name. Doing home installations is fabulous because you have the ability to numb your bladder wall when you're flaring. That is fantastic. But I would also challenge you a little bit and say, it would be very, very nice to know your phenotype because in the end, those installations don't fix anything. They just control the symptoms. And it would be really nice to know what's triggering the symptoms in the first place. So in my case, the reason why I was up all night peeing was because my muscles were like concrete. And no bladder treatments worked for me. Nothing worked for me. And it wasn't until I did pelvic floor physical therapy and got those muscles healthy again that all of my pelvic pain pretty much went away. So, a lot of patients, they're like, I don't want to do physical therapy. It's embarrassing, or I don't understand why it's my bladder, because they just don't understand the relationship between how the muscles can directly trigger bladder symptoms. And so I'm really glad it's working for you, and I'm not criticizing you at all. I say if it's helping you, by God, by all means, it's helping you. I would just ask you to take it a step further and try to understand why it's happening in the first place. Is there any chance you have tight pelvic floor muscles? Is there any chance there's anything else going on that could be triggering this? Lisa, thank you for the 500 stars. Perla says, how do you treat tight pelvic floor muscles with physical therapy? Caddy says, does lactoferrin interact with heart meds, or can you take it if you have a history of AFib? Girl, I had my first AFib attack a year ago after a vaccine. Scared the living daylights out of me. Let me go to the National Library of Medicine and let's see. So I'm just going to search for lactoferrin AFib. Let's see if there's anything on that. Okay, hold on a second. Okay. It's a study with Graves' disease in which patients also had tachycardia and some had atrial fibrillation. Okay, the study does not specifically say lactoferrin. It says a decrease in the levels of inflammatory markers during treatment confirm involvement of immunoregulatory proteins. Okay, that's not really helpful, is it? Okay, hold on. Let me see if there's anything with heart disease. Oh, this is weird. On May 25 in the International Journal of Molecular Science, the potential of edible bird's nest in reducing cardiovascular disease risk factors. Where was this done? In Malaysia. And so edible bird's nest, a food rich in bioactive compounds such as sialic acid, lactoferrin, and glycoproteins, has been shown to exhibit antioxidant and anti-inflammatory effects. Edible bird's nest has been shown to improve the lipid profile, reduces weight gain, visceral fat accumulation, enhances insulin sensitivity, which may collectively support cardiovascular health. Despite promising findings, clinical evidence remains limited. Okay, so is there anything else here? Lactoferrin influences atherosclerosis. So here's one on heart failure. I'm not seeing a study that would immediately answer your I'm not seeing any AFib lactoferrin. Here's a study. Lactoferrin attenuates cardiac fibrosis and cardiac remodeling after myocardial infarction. Um, let's just look at that real quick. The study aims to establish a cardioprotective effect of lactoferrin. Okay. Our study established the cardioprotective role of lactoferrin in attenuating cardiac remodeling and improving cardiac function by inhibiting activation of myofibroblasts through suppressing a specific pathway that happens after heart attack. They say treatment with lactoferrin may serve as a potential novel therapeutic intervention in patients with myocardial infarction. That, honey, is the closest that I can get in this meeting to giving you something that might show benefit. So I will give you a link to that if you want to look at it. All right. How are we doing here? Deb says, I've been dealing with IC issues for 10 to 12 years, have tried it all. Recently had a discussion with my urogyne about revisiting the diagnosis. No, thank you. So we tried Cymbalta. Wow, changes for the good are happening. It's been a month and I'm feeling very positive. Excellent, Deb. Good, good, good. Hi, Gay. Karen says, I'm toying with getting a pudendal nerve block. What are your thoughts? It's a great diagnostic method. If it turns your pain off, then we know it's your pudendal nerve is the problem. You got to be careful. Karen says she's living on azo. Azo has now been linked to cancer, not meant to be used long term. Jess says, with high-risk breast tissue, they removed all of my estrogen therapy and progesterone. You're still saying topical estrogen is okay. Well, you're talking to a breast cancer patient, girl. My bosom is gone. And I had estrogen-dependent ductal carcinoma in situ. And that was the very first question I asked my oncologist is, how do you feel about topical estrogen? She said it's fine. It's not linked. It has not been linked in any great degree to cancers because the estrogen tends to stay in the skin, but it also depends upon the type of cancer you have, the gene of cancer, like it's the BRCA gene, et cetera, et cetera. So this is a discussion you need to have with your oncologist. I use topical estrogen. I will tell you, I don't use as much. But I no longer have a uterus or ovaries, and I no longer have breath. But I've been scared silly and traumatized by breast cancer. So I understand your fear about that. Nia says, it's been 3 years. You've seen 7 pelvic floor physios, 4 urogynes, so many more. Can't get an answer. Nia, call me. 800-928-7496. And guys, I do have to tell you that our 800 service is being attacked by robocalls. And we may have to cancel it because we are getting thousands of robocalls from computers and they're charging me for that. And the company at this point in time cannot fix this. So don't be surprised if our 800 number disappears for a while. We may have to go with a different service and change our number, which would suck. But anyway, 800-928-7496. Maria says, so tight pelvic floor muscles can cause inflammation of the bladder wall? Hell yes, absolutely. Absolutely. Having tight pelvic floor muscles is not healthy. Those tight muscles are squeezing blood vessels, or squeezing nerves, or squeezing other tissue. And if your bladder is supposed to get 24 units of blood a day and it's only getting 10, are you going to have a healthy bladder wall? The answer, of course, is no way. There is no way you're going to have a healthy bladder wall if your muscles are very tight, because it's depriving that wall of oxygen and nutrition. So it's very, very normal. It's very, very normal for these patients to have what we call pelvic ischemia and to struggle with frequency, urgency, pressure, pain. The problem is that bladder therapies will not work at all. They will not work at all. They never worked for me. And now that we know, I mean, the muscle research didn't happen until 2008. I was diagnosed in 93 or 92. Kayleen said, it just jumped on in time after my MRI. The hysteroscopy and IUD replacement was more painful than I thought. Still needing to take it easy. Yeah, the hysteroscopy is, for anybody who doesn't know what a hysteroscopy is, it's basically an opportunity for your doctor to look in the uterus and take a urine sample. I mean, not a urine sample, an endometrial sample. So I had one. That's because I had early uterine cancer, early uterine cancer. So you're basically in stirrups in the doctor's office, and they have this really long needle, and they stick it up there, and they numb your cervix, and then they pry your cervix open, and there's this sharp little jab, and they take a sample, and then you're done. And there have been a lot of discussion about here, hold on a sec. There's a lot of discussion about the pain that it causes, and that patients are not being adequately anesthetized. And I'm going to, I remember my sister had one done, and she called me sobbing from her car. And she said, don't ever, ever, ever let anybody do a hysteroscopy unless I'm there for you. And so she was with me, and she had my hand, and she was squeezing it hard to distract me, and it worked. Man, the things we go through. Marcella says, okay. Okay, so we did Marcella's question. So you guys on YouTube, remember, I'm here as long as you have questions, so keep asking questions. Once you're done, you're done. I have to tell you what happened this week. You want to hear a funny story. But let me finish your questions first. Deb said, been dealing with IC for 10 years, have done it all. PT was the best, but recently had a discussion. Okay, so we did that. You did the Cymbalta. Okay, and Kayleen says she's hoping the MRI will rule out Tarlov cysts, as I had one last year. Good. Thank you, Gay. You know what this means is I didn't have time to wash my hair. So you got braids instead. So while you guys are writing out your questions, I'm here as long as you have questions. Also, I'm more than happy to start up Zoom. If people want to come into Zoom and talk to me directly, that's not a problem at all. I'm happy to do it. So since I don't have any more questions right now, I'm waiting for you to ask me questions. I got to tell you my drama. So for those of you who know me, I cared for my elderly parents for many, many years. And I lost them 2 years ago. They used to come in all the time. I was their caregiver. My dad lived to 100. My mom lived to 94. It was a joyful situation, exhausting, but no regrets. But I hadn't made any changes to the house in 2 years. I just was dealing with grief and trying to figure out how I was going to respect their belongings. And then I got cancer last year, and breast cancer, and that just screwed everything up. So finally now, I turned 65 last weekend. And my sister said, what do you want to do for your birthday? And I went, I know what I want to do. It's time to work on the house. So my first choice was to pull up the carpet in my parents' bedroom. which my brother-in-law Brian helped us do. Underneath that carpet, we found pristine, beautiful wood floors. Gorgeous wood floors. It's like, why they covered up these wood floors is beyond me, but they covered them up, when we moved here when I was a kid. So we're like, yeah, first decision, move the furniture around. This is good. And then 2 hours later, we noticed a smell coming from underneath the house. Now, directly underneath that room is the man cave, my dad's man cave. He was a ham radio operator. It stunk. It has stunk for decades. Hot metal, a sour metal smell. He had like 2 tons of radios down there. And I couldn't stand the smell. It's so awful. So last Monday, I had to put a towel underneath the door because I would be sitting here working, getting a waft of this awful smell coming in. It's like, God bless America. No, no, no. So that then, here Sherry says, Crystal says, what's a number? It's right at the top of our website. So if you just go to icnetwork.org, you'll see it right there. It's 800-928-7496. And then Sherry says, I ordered the lactoferrin from the shop. I'm hopeful. Yay, good. Give it a shot. I take it because of the cancer. I mean, the research with lactoferrin and cancer is really good. Okay, so let me get back to my story. Kayleen, hold that. So now I've got this beautiful hardwood floor that stinks. So we go down to the man cave where the stink is originating from. And it's like, oh my God, this is so bad. Now, whenever you do one thing, there's this whole ripple effect. It was time to demo the room. My dad had stuff everywhere. So it cost me $2,000 to hire a crew to come in and demo it. And when they pulled down the wooden walls down to the studs, what did we find? Black mold. Old black mold. And it's like, okay, the smell's coming from the old black mold. So then I got this very fancy, very expensive treatment because it wasn't fresh black mold. It was old black mold. And last week in the morning, I primed the cement blocks where the mold was. Thinking, okay, this is going to get rid of the smell, right? Well, I got rid of the musty smell, but the underlying metal stink, still there. Like, oh my God. So then I'm going, okay, I'm going to have to put carpet upstairs again. And I was talking with a guy at the carpet store saying, no, what you need to do is you need to put a vapor barrier and insulation under the floor. And it's like, okay, well, I had already done that the rest of the house. They quoted me $2,000 to do a 15-foot by 15-foot section. I'm like, I'm not going to spend that. I just spent $2,000 to demo it out of my retirement, right? So then my brother-in-law comes down and we buy the insulation and we insulate it yesterday. Man, let me work with my hands. I'm a happy girl. And then I'm like, okay, where the hell is the smell coming from? And I literally, you're going to think I'm a nut. I sniff every damn piece of wood, every 2x4. And I found it. One 2x4 stunk like it had been soaked in turpentine. And we pulled it down, got it out, and you know what? After 50 years, the smell is gone. It's like, oh my God. I went down there this morning. It's gone. And for those of us who are smell sensitive, like I have a wicked sense of smell, having a nagging stink in the house is not healthy. So decades decades of horrific smells that my dad didn't smell, but I smelled, all came down to one piece of freaking junk wood that they used to put stuff, to put the fake the wood siding on. And I'm just so, it's like, oh my God, you have no idea how important this is. And so now I think we're going to drywall it, and I'm going to move all of my streaming down there so that I've got a new fresh environment and I can make videos. I'm excited. So anyway, it's been a busy weekend, but I'm very happy about it. All right, let's go back to Kayleen here. I asked for full general anesthesia, and he gave me 2 strong pain meds. I will never get 2 pelvic procedures done in 5 days apart. I had to go to the ER right after surgery because my rib felt bruised. 9 out of 10 pain all the way up to my neck. Turns out my white blood cell count is low, so that might be why I'm so tired and in pain all the time. Yeah, that's interesting. Kayleen, that's very interesting. Why would are you eating? How's your eating? We've got to nurture your body, and we have to make sure it has good nutrients. And I know that eating has been challenging for you. Have you made any good breakthroughs with eating? Are you eating better now? Sheena says, I've never seen a pelvic floor therapist, and I've been doing this for 24 years. Diagnosed at 19 after a cystoscopy, found Hunner's ulcers. Doc told my parents I'd never finish college and never hold a job and would be in bed on disability my whole life. I said, no. Girl, you are my twin. I said no to disability checks, finish college, have multiple degrees, licenses, certifications. You worked full time, side jobs since you were 17. You take little to no meds. I've never done even a small portion of what everyone does to get through this. All that to say is it does get better. I'm now in the middle of a bad flare. Sheena, you know what they said to me? You will forever be a burden on your family. This is your life. You will always live with severe pain. Get used to it. And that was the moment I went from being a victim to being damn angry. And I said, I will prove you wrong, you son of a bitch. How dare you say that to me? That was an emergency room doctor who said that to me when I was 32. And you got to understand, I had been struggling with the widespread pain conditions for over a decade. And the pelvic pain and the bladder pain had me on my knees. I'm like, oh, hell no, dude, no. And I came home, and like you, I said no to disability. I started working part-time. I started working from home. I was writing. I was with my master's degree, I was an organizational development consultant. I did exactly what you did. I've got 3 degrees. I've got awards, all with this history, all with somebody who said, you will always be a burden and basically an embarrassment to your family. Well, screw them. I certainly have never been a burden since then. I'm an asset to everybody who knows me. I try to be. I work hard, just like you, to prove them wrong. But here's the thing, Sheena. You got to understand that when you were diagnosed 24 years ago, man, those are the dark ages. I was diagnosed 30 years ago, 32 years ago. Okay? All the information we knew back then, it's all thrown out. We don't even think of IC as a bladder disease anymore. Most of the world doesn't even use interstitial cystitis. Most of the world calls it a bladder pain syndrome or pelvic pain syndrome. Emphasis on the word syndrome, because what we now know is that bladder disease is rarely found in the IC patient. In contrast, pelvic floor dysfunction is found in 85% of patients. And if you look at all the research, you see that bladder therapies perform no better than placebo. Elmeron, it's a perfect example of that. Elmeron should never have been approved by the FDA, in my opinion. It took them 18 years to do the study that proved that it didn't work. 18 years, patients took a medication that had the potential of damaging their eyes. And, it's even being used now, even though we know now in multiple, we just know it's just ineffective. Today, we phenotype. We try to figure out what group you're in. Also understand 24 years ago, some doctors didn't know what Hunner's lesions looked like. They assumed it was a lesion, but it might not have been a lesion. If you had little red dots on your bladder, that's called petechial hemorrhaging or glomulations. We thought that was a bladder disease. Now we know that that's from the test. That when you stretch the bladder, that's what you cause. Little tears, sacs in the bladder wall. So what we're trying to do now is find patients just like you who have been told that you have an incurable bladder disease to try to make sure that you get a proper diagnostic workup now. Because if you're like me and you turn out to be pelvic floor driven, pelvic floor physical therapy heals. Now, you notice I'm not using the word cure because there's no disease to cure for most of us. What we're trying to do instead is we're trying to heal an injury. We're trying to heal a wound. So the fact that you're flaring now, I'm sorry you're flaring. The first thing we want to think about is you're just older now, and there's a chance that you've got more estrogen atrophy now and that your bladder's more vulnerable. It's very common for patients who diagnosed in their 30s and all of a sudden in their late 40s, early 50s, their symptoms come back and they really worry, oh my God, it's back. What am I going to do? What am I going to do? When the reason why their bladder's more sensitive is just that they're in estrogen atrophy now. And so we know what to do about that now. We know at that moment, we've got to protect your bladder wall because it cannot defend itself because it doesn't have mucus. Not a disease, it's just estrogen atrophy. So diet matters. And in the same sense, doing things that will give the bladder a chance to produce more mucus, like topical estrogen, or maybe doing a chondroitin-based supplement that will coat the bladder wall and protect the bladder wall is where we go. So if you've never seen a pelvic floor physical therapist before, what do you have to lose? Because today, in our national guidelines, the single most important diagnostic test is the pelvic floor exam. Because now we know that 85% of patients have tight muscles, and our first recommended treatment is pelvic floor physical therapy because in research it works. Bladder therapies don't work for the great majority of patients. You're looking at no better than placebo, 20, 25%. Pelvic floor physical therapy helps like 70 to 80% of the patients who do it. And I am living proof of that. And so it would be very interesting to maybe try to, and you're welcome to call me. It's free. It's okay. And we can have a little chat. I will tell you that when symptoms usually begin in the 20s or 30s, we really look at injury first. We look at pelvic floor injury first, whether it's from having a baby, a fall, a car accident, or a history of sports. That's typically what we find in that 20-year-old or that 30-year-old, unless we're looking at a lot of other related conditions, the IC, the IBS, the vulvodynia, the TMJ, et cetera. That's when we're going to start looking at the nervous system and the central nervous system and things like that. So feel free to give me a phone call. I had my nephew and their kids and my sister, my brother-in-law here yesterday, and oh no, it wasn't that. It was when it was a couple. It was for my birthday. My best friend came over with a couple of other people, and they went to get a glass, and all the glasses in my cupboard are jam jars. They're like, wow, you have a lot of jam jars. And I'm like, well, my parents pretty much broke all the glass jars eventually because they dropped things. And I don't eat butter anymore on my toast. I put jam on it. So I go through jam jars. I thought it was pretty funny. Kayleen said, I'm bruising easy from being malnourished, and the puppy has been jumping on me, so he's probably bruised my rib. Well, yeah, I went through a point where every time my old cat Sammy jumped on me, it would hurt like a dickens. And I finally just had to pick her up quickly and get her off of my lap. And she was very confused, like why I was doing that. But I was hurt. Do they have you on iron yet? Are you doing iron? Are you doing anything for getting? I mean, if you're bruising easily, what do your lab tests show? Sheena said, that's what I said. There was no way I was giving up at 19. At the time, I was peeing 60 times a day. I started doing research, changed my diet. Sheena, girl, power to you. That's the attitude I want to see in IC patients. And you're now a full-time supervisor over 4 counties in Florida. I work with juveniles in the criminal system. Not always easy, but you make it one day at a time. Good job, girl. By the way, you might have some insight for me. Every now and then, I get a letter from an IC patient who's incarcerated, and it's very, very difficult. So I send them the paper, any information I can do in print, I will send back to them. But they have no ability to control their diet, and diet is so important. It's a challenging situation, and very similar to what we see in patients who are in assisted living or in nursing homes. I mean, they just have, when you lose that control over what you can eat or not eat, and when they just give you coffee and soda, it's horrific what that can do to the bladder over time. Kayleen said, also had an ER doctor tell me to go home and deal with this debilitating pelvic pain. It only made me get out and fight. Good. Good. Sheena said, never tried Elmeron, never will. Yeah, no, I never did it either. I mean, I'm a pharmacologist, so it never made sense. Elmeron's a Band-Aid, so if you swallow a Band-Aid, you expect it to come out the other end of Band-Aid, and the answer, of course, is no, we have digestion. The fundamental flaw with Elmeron is that the vast majority of it is destroyed by digestion, 93, 92, 93, 94%. So only a tiny amount of it actually makes it to the bladder to coat the bladder. And so you have to take a lot of it over time to get that, to build up that chemical Band-Aid. And that's probably why the Elmeron, I mean, it's such a big exposure to it. It's known for causing inflammatory bowel disease and retinal disease. It turns out that your retina has a gag layer on it. Elmeron attaches the gag layer. Lori said, I was told that I would have to have my bladder removed 20 years ago. Of course, I didn't take that advice. Pelvic floor therapy and pudendal nerve blocks have been a blessing. Lori, excellent. Thank you for sharing. Moving from depression and being the victim to being angry and being productive is a really important transition, I think, for anybody who's suffered with something like IC or chronic illness. Because, man, we gotta fight back. And the way we fight back is with knowledge. You can't start yelling at your doctor. That doesn't help. You gotta study and learn so that you can challenge them with good constructive information. Sheena said, I flare several times a year, usually from antibiotics, ocean water, and high stress. So when you're under stress, what happens? You subconsciously tighten your pelvic floor, and those stress flares could be pelvic floor flares. But I do happen to have in our latest guide a thing on stress flare. Because the other thing that happens is if your brain goes into fight or flight, as can happen during periods of intense stress, that then amplifies the central nervous system, which then amplifies pain throughout the entire body. So getting that brain out of fight or flight is really important. So here is our stress flare thing. What are our triggers for stress flares? Stress, from a stressful workplace to conflict at home, stress can lead to persistent fight or flight, which can then trigger a variety of symptoms in the bladder, bowel, migraines, etc. Adverse childhood events, caffeine, chemical exposures, even restricted restroom access can trigger a stress flare. So I've got a whole section on what are we going to do for stress flares? How do we calm stress flares down? Because we have to work on the central nervous system. So I give a lot of central nervous system tips here. Rebecca said, I've been using a low-dose estrogen patch. I had a full hysterectomy. I feel better than doing the cream 2 times a week. All right. Power to you, girl. Sheena said, the only reason I don't go to physical therapy because I'm scared it will make it worse and the internal work doesn't thrill me. It's odd. And not messing with things tend to keep things under control. Don't rock the boat. Yeah, but hun, you have to focus on anatomy here. As long as those muscles are tight, you have restricted blood supply to your bladder, and your bladder is always going to struggle to grow and to heal. Again, if your bladder needs 24 units of blood a day and it's only getting 10 because your muscles are tight, you're screwed. You're screwing yourself in the long run. We have got to get these muscles healthy. So, the other thing that happens, which is so interesting, is that somebody will go to pelvic floor physical therapy, and the whole purpose of the first appointment is what we call assessment. So when you go for a pelvic floor assessment, pretty much they're going to have you walk up and down a hallway. We want to see how you walk. They're going to measure your legs. You have one leg longer than the other. That tilts the pelvis, which can put stress on the pelvis. And your ability to describe your symptoms gives them a roadmap. So it's very, very important that you pay attention to details. That weird random symptom that happens every now and then, once in a blue moon, is often the symptom that confirms the diagnosis. And so do you have sciatica? Have you ever had pain shoot down your leg? Do you ever have some patients' feet go numb? When they flare, when their pelvic floor muscles get so tight, they squeeze the nerves that affect their feet, and their feet go numb during a pelvic floor flare. That's how devastating tight pelvic floor muscles can be. Or you might feel a vibration, or you might feel pins and needles, or you might have areas of skin that are numb. So again, your ability to describe your symptoms to your physical therapist gives them a roadmap on where to look. But the other really important thing that you have to tell your pelvic floor therapist is any previous trauma. Were you a gymnast? All you got to do is say you're a gymnast, and we know you got pelvic floor. We know you've had many, many falls on your pelvis. So were there any accidents? Were there any bad falls? One of my clients, for example, her accident happened when she was a teenager, and they were frog leaping over a fire hydrant. And you know how that fire hydrant has a big knob, concrete knob at the top? She landed on that knob so hard that she was bleeding profusely from this broken tissue around her vagina. It was a massive catastrophic injury, exactly where you don't want it to be. And she ended up at the hospital, and it was just her. And she's not the only. I've worked with several patients who have had traumas like that. And the legacy of that injury, she had a compression injury. So all of her weight landed in this small area that physically compressed the nerves it compressed and broke blood vessels. She was bleeding, and it compressed muscle fibers. So the legacy of that injury was scar tissue and muscle tension. So, and that affected her entire life, this early catastrophic injury. We have Susan, who comes into our meeting regularly. Sue, if you're here, hi. I don't think she's here. I haven't seen her here. Diagnosed with IC for a decade, never got better on bladder therapies. Finally what made her interesting is that when she went to pelvic floor physical therapy, it always hurt in one spot. She didn't like physical therapy because there was always one part of her pelvis that hurt significantly when they did it. So she then went to Ken Peters, one of the top diagnosticians in the world, and he figured it out. What she had, so if we look at the pelvic floor here, on one side of her pelvic floor was a giant wad of scar tissue going in and out of this muscle. And he said, you got scar tissue here, and you don't have a little, you got a lot. And she goes, oh man, I know exactly when that happened. She fell off a horse very, very badly. So in her case, big time scar tissue. So I think it would be reasonable to go have a pelvic floor assessment. And we've got excellent physical therapists now. Very, very good physical therapists that are fully certified in pelvic floor to just get a sense of, is there anything funky with your pelvic floor? They will eventually say, can I do an internal exam? Your answer hopefully will be yes, because that's how they can touch the muscle. And so what she's going to do is she's just going to touch muscle groups, right? That's all. And if she can touch a muscle and trigger pain, that is your hallelujah moment. And your answer is, oh my God, that's it. What are you touching? And hopefully you will walk out of that appointment knowing that it is your left levator, your right piriformis. We will know then where the injury is. And then based upon that information, now we can rehabilitate that injury. Because the thing is that muscles respond beautiful to therapy. They do. Years, decades after the injury, you can rehabilitate that muscle. Muscles are remarkably forgiving once you start working with them. And again, a tight muscle, a healthy muscle feels like a raw chicken breast. It's soft, but it has substance. A tight muscle feels like a cooked rubber chicken breast. A badly damaged muscle feels like beef jerky. So she's gonna know in 30 seconds. She's gonna know in 10 seconds what she's dealing with. You don't need to fear the internal work at all. But we got to try to get these muscles healthy because, girl, your life has. Listen, you have risen to the occasion. You have to be so proud of everything you've done up to this point. Power to you. You are a role model to other IC patients. We are twins in our reaction to this. But you're still flaring. Your life is still irrevocably changed by these symptoms. And that's what we want to get better. Is if we can find that underlying problem and fix that underlying problem, then maybe, just maybe, you won't have to worry about this so much as you get older, right? So anyway, that's my perspective. Lori says, I had a very bad experience the first time I tried pelvic floor PT. My current PT is great. I can't imagine what I would do without her. So Sheena, I will tell you that the first time I did physical therapy, it was great. Then I had a hysterectomy and my muscles went into spasm for a year. And I would be emailing and messaging my doctor, what is this? What is this? This is making me crazy. I would feel this pulling sensation whenever I sat down hard. And my muscles were quivering. And my doc was like, oh, Jill, you just had surgery. It's going to get better. You're just recovering. Well, come on. 8 months later, 10 months later, my muscles were still quivering. And when he finally saw me again, he's like, "Oh my God, I can see your muscles quivering." And I'm like, "Yes, I know. I've been telling you this for months." And he goes, "Okay, well, we know how to fix this. We need to go to physical therapy." I'm like, "All right, sign me up, baby. I'm ready. Let's do it." And he goes, "Well, I want to warn you, a lot of women drop out." And my answer was, "Well, I'm not a lot of women. Sign me up." And he goes, and then I was like, "Why?" And he goes, "Because it's painful." And again, because I was recovering from a hysterectomy, the first time I went to physical therapy, I mean, like, I have never, ever found physical therapy to be painful. I feel it after I put my clothes back on and I start walking out to the car. That's when I go, "Oh, we have just worked with these muscles. Yikes." And again, after my hysterectomy, when I went back to physical therapy, the first two times I cried all the way home in pain. But the third time, it didn't hurt as much. I mean, I knew what to expect. Pain doesn't scare me so much. I mean, I've got my heating pad, I got my muscle relaxant, a little bit of pain med if I need it, you know. So tight, injured muscles, like muscles that have been injured through surgery, yeah, they're going to be annoyed that you're messing with them. But we got to remember our long-term goal, and that is to get the muscles healthy. And by the third appointment, I didn't cry. By the fourth appointment, I didn't cry. And ironically, now, just to give you a perfect example here, you know, I had a double mastectomy a year ago, and the same thing happens with my physical therapy for here. If she'd work on it, I'd be fine. Then I'd cry all the way home. I have a lot of nerve damage here. But in the same sense, I had to get better. And so I was willing to risk it. The last time I went and saw her, I think half of the time I'm crying on my way home, it's really just kind of reliving the trauma of everything. You know, my body is just over it. My body is saying, "Leave me I'm always going to swear that. Just leave me alone. Leave me alone. I don't need any more trauma." Kayleen said, "My iron is normal along with other things. So we're all stumped. I see my primary on Friday." Caddy says, "Your IC Network food list has helped. I have not bled anymore." Yeah, and you guys, we updated our food list. It's free. It's right on our website. It was updated earlier this spring, and then we have an updated flare guide. And I've got a new IC 101 guide to managing flares, almost done. Then we're going to do a brand new IC 101 guide to the IC diet. That's half done. And then we're going to do our IC 101 guide to managing pain, which I haven't started yet. Lots of projects here. And also, just so you know, I filmed 11 new episodes of our IC 101 video series. So we've got to do the post production for that, and that's where. So just understand, for anybody who's seen the video series, the first two videos were made 2 years ago. I mean, the first 20 videos were 2 years ago. I had the same shirt, I had the same earrings, same set. Okay. But I don't look the same because that's 2 years of grief and cancer. So don't be surprised if you watch the new ones that we're putting up, that I'm looking a little bit different. Yikes. Sheena says, "Has anybody tried Rocephin shots? I've done those a few times and it stops the flare. I heard recently they had a recall because people were dying from it recently." I'm not aware of that. Let me see if I can find that. So Rocephin is an antibiotic, right? They recalled Recefin in 2019 for the injection version of it. Because it had particles in it from the manufacturing plant. And then in 2012, there was a manufacturing error. So, okay. So let me challenge you here again. Antibiotics, the reason why some patients feel better after they take an antibiotic is because they have an anti-inflammatory effect. But antibiotics are not generally treatments for bladder wall or pelvic floor flares, because the more antibiotics you take, the greater the risk of developing severe drug-resistant infection. So I think it would be very, very interesting, Sheena, for if you email me, I will send you our flare management guide, no charge. My email is icnetwork@mac.com. In fact, anybody watching this right now, if you want a free copy of our guide, I will send it to you. It's not a problem. icnetwork@mac.com. I would want to know what kind of flare you're having, because there are a bunch of different types of flares. Okay. Angela says, I look beautiful. Thank you. Wow. Life is getting old is weird. That's just all I can say is just very, very weird. I feel like I'm finding myself again. I feel like after 10 years of elder care, 30 years of running the IC network, and then losing my parents and then getting cancer, I hadn't been happy for a long time. I was stressed, trying to keep people alive and then to keep myself alive. And there wasn't a lot of joy. And, I mean, my joy in the day was hearing somebody laugh. But I think on the inside, I was just weary. Just I did not understand the stress of all of this. And it brought me to my knees, girls. It brought me to my knees. And so getting some trauma therapy was really good for me. And I did that last winter, and doing some EMDR therapy to just try. I was having pretty dark thoughts. I mean, I was with the cancer. It's just like, maybe death would be better. And I was never suicidal. I'm not saying that, but I finally understood why my parents didn't fear death, because it was a welcome refuge after suffering. And that's how my struggle with cancer affected my emotional state. So I just made I just had to say, listen, there anybody else out there responsible for my happiness? I am the one responsible for my happiness. And I started just making changes to bring joy into my life again, and to give myself an opportunity to do things that gave me comfort. And I paint, I garden, but probably the most important thing has just been, I go to the gym every day now. And it's like I'm feeling the Jill when I was in my 20s. I was at the gym this morning for 90 minutes. And I think I have already lost weight. and I am building muscle back. But I think most importantly, I'm finding myself again, and I'm finding the things that brought me happiness again. Because in the end, my identity is as an athlete. And so I feel like I've made a really good stride forward. I hope that helps. So thank you, Angela. Catherine said, I was in a flare for 5 months. Over it now, but last weekend I had a dog attack my ankle. Oh my God. I'm on antibiotics and in fight or flight big time. I'm so afraid that I will go into another flare. Is there anything that I can do? Does penicillin affect the bladder? So do you have, Catherine, did you have a really big wound? I mean, did they have to do stitches, and you're on antibiotics to prevent the infection from the bite? I mean, you got bit, right? Some antibiotics like augmentin can be quite irritating to the bladders, others not so much. Amoxicillin usually not that irritating to the bladder. I'm really sorry that happened to you. I think okay, so number one, the worst has already happened. The bite is over. Not going to happen again. And you will now protect yourself around whatever dog that was. Hopefully you've talked to the authorities, et cetera, et cetera. The authorities need to know that you were bitten. You need to be compensated for your medical costs, all of that. No shame, no blame, girl. Somebody lost control of a dog and that dog bit you. There are lots of those cases on Judge Judy, and she's like very blunt. If your dog is aggressive and bites somebody else, you pay for it. Doctor said no stitches because it could. Their doctor thought it could more easily get infected. How does it look? Is it healing or is it pretty puffy? How does it look? I was trying to do this. Okay, like this is a hairstyle. See, now you can see how white my hair is. So I was trying to do like a Heidi hairstyle. But see that change? Look at that. My hair grows 6 inches a year. So this is hair from 5 or 6 years ago. And sadly, it is now lighter. So Borea says, you've got an eye problem. What do I do? You have an eye problem from Elmeron? Catherine, I think if you love to walk like I do, you just need to get some pepper spray. I mean, get some. I'm just having the confidence. You probably never ever use it, but having that in your hand or in your pocket, if you see an aggressive dog, would I think give you a lot of comfort. Because what we don't want you to do is we don't want you to stop exercising. You are entitled to be out and enjoying the summer day and the summer evening. No inflammation, taking arnica to reduce inflammation. Good. Sounds like you're over the worst of it. It sucks. Borea has zapping eye issues with Elmeron. So have you gone to a retinal specialist yet, Borea? That's your first stop. You got to go to a retinal specialist to have them confirm that you've got pigmentary maculopathy. Are you taking Elmeron now, or have you stopped? Once your vision has changed, normally you would be off that medication completely. Hopefully you've been off of it for a couple of years already. So if your retinal specialist says you have pigmentary maculopathy, your next step is to contact an attorney. 100% contact an attorney, because I mean, they're basically writing $300,000, $400,000 checks to patients. I don't think that's enough. I think you need to get lifetime eye care. They need to pay for every damn test you have on your eyes for the rest of your life. They need to pay for every treatment on your eyes for the rest of your life. And if you ever get to the point where your eyes are so bad that you're now legally blind, they need to pay for any aid you might need to do what you need to do. Yeah, but remember, it has to be a retinal specialist. Okay. All right. So hold on a sec. Diane says, I was thinking of asking my first neurologist who said, or urologist said, I didn't have Hunner's lesions, for pictures from the cystoscopy and the hydrodistension she did a couple years ago. The pictures are good quality, meaning she has up-to-date technology. Would you be able to look at them? Sure. And any other doctor should be able to look at them too. I mean, we have a whole atlas now of what Hunner's lesions look like. So you could actually compare your pictures to the atlas. I have pictures. I can show you what the pictures look like. But just remember, I'm not your doctor. I can't give you medical advice, but what I can give you insight, and then I can give you more questions to ask your doctor for sure. I am a support group leader. I must know my place. I try to respect my place every day. Yeah, retinal specialist. All right, well, we've been on for about 2.5 hours. So I will make this offer. If anybody wants to talk to me directly right now, we can go into Zoom. But I think I need more questions. So what's happening here in the IC Network office? We will be finishing up our IC 101 guide to managing flares. You know what's so interesting is you can see this arm. No, it's this arm. It looks a little, you know why? You know why my right arm is bigger than my left arm? Because I was a tennis player. I was a big time tennis player. That is annoying though. I'm always hunting for lymphedema, but I didn't have cancer on my right side. So this is just fat and muscle. It's the left side I gotta watch. You look at I was watching the Wimbledon finals last weekend. It's amazing how much bigger one arm is over the other in those tennis players, and I'm definitely that way. All right, well, I think we're kind of done. I'm here as long as you want me here. If you got questions, please ask them. Or I can put a video on, a couple of videos. I could even play some of the new videos. They're not even up. Oh, you know what? I can't because I'm not using my streaming software. So sorry, I cannot do that. My streaming software is broken. You're welcome, Lori. Thank you, Boria. All right, guys. You know what I'm going to go do is I'm going to go downstairs and sweep up. Because it's a little messy, but I'm so happy the smell is gone. So I will see you next week. Knock on wood. And I truly hope you guys have a great time this week. And if you have any questions, feel free to give me a phone call. I'm here every day. All right. I'm going to say goodbye to YouTube first. See ya, YouTube. All right, my friends.